Hello. So a lot of people ask me as an instructor, what is the best way to teach someone how to do a venipuncture or venipuncture, how to do phlebotomy? How do you get them from the classroom day one to professional phlebotomists out there looking for jobs and being successful at the craft? Well, the real answer, the way that I do things, is to hit the ground running. Day one, I have my students doing actual phlebotomy procedures. We have a nice volunteer here. If you notice, right now I am sitting in the chair. Sir, how many times have you done this before?
0 times.
First day?
Yes.
Nervous?
Yes.
Why?
Don't want to hurt you.
I should be the nervous one, not you. I feel the pain, not you. So we're going to assume that he already got my information. He double and triple checked it on the requisition form. First name, last name, date of birth, and maybe some other identifier. Some people will use the last 4 of the social, medical record number. The only way to figure out that third one is to find your own method. So at this point, I'm going to go on ahead, roll up my sleeve. As I roll up my sleeve, he's going to go on ahead and tie the tourniquet. Tourniquet nice and tight. Still need practice with that tourniquet. Okay, so make sure, however you feel comfortable. You feel comfortable like that? So just remember. Okay, ready? And whenever you're ready. Okay, so now he's going to go and remove the sheath from the needle. Anchor the vein with this hand, with this thumb right there. Hold it nice and taut. And then with the needle itself, you're going to go straight in. Needle's curved, you're going to miss the vein, so turn your body just a bit. There you go. And in you go. Okay, you are in the vein, don't let go of the needle. You're going to get the tube. You're going to stick it into the vacutainer.
Like that?
All the way. You should feel a click. And if you look, right, let go here, keep holding the needle. Blood is going to start flowing through. As the blood is flowing, he's going to go on ahead and remove the tourniquet. Tourniquet, not the needle. Other one. Perfect. And the tube is still filling. So at this point, you would go on ahead and remove the tube. Always remove the tube before actually removing the needle. Drop it in the sharps container. Gauze. And then needle in the sharps container as well. If you notice, he did not use a Band-Aid with me. The only reason for that is that I do get reactions to the adhesive on the Band-Aid. But for your normal patient, you would ask if they would prefer a Band-Aid or not. Thank you. Thank you.
Thank you.
Going to locate the vein. And you can go and feel that bounciness. You found it? All right, cool. So now pull the small tab. Perfect. You're going to clean with alcohol. In the center, work your way out. If you saw, he never went back towards the center. This point, gloves. Last thing you want to do is blow on the site. Try to fan it because you will get dirt and bacteria that's naturally in the air onto the site. Get the piece of gauze, fold it in 4. Nice and tight. You can just put it wherever you feel that you will find it. So he's going to be demonstrating with the butterfly needle, and the reason why they call it the butterfly needle is because it has the wings at the end. Now we have just opened this up. What you're going to want to do when you just open it up is remove any kinks. Put that there, go on ahead and assemble the Vacutainer to the butterfly. So just go on ahead and screw it in.
This here?
No, to here.
Got it. Like that?
No, other way.
This way.
As you can tell, and then just screw it in. Perfect.
Mm-hmm.
So, best way to keep the Vacutainer stable, there are two ways of doing this. One, you can use your hand like so, or I've seen other people keep it on a surface like the phlebotomy chair. Only downside to this is that there is a possibility that it could roll off and you don't want the Vacutainer hanging. So see if you feel comfortable holding it like this and using your pinky and ring finger.
Okay.
Okay, so just make sure that as you do that, you have that opening out.
Got it.
Okay, perfect. So now he's going to reapply the tourniquet without touching the site that was just cleaned, without fanning it or blowing on it. That's old school. My grandma used to love doing that. And there you go. Again, the tourniquet, you want that small loop.
All right.
Actually, can you cut